Hi, Dr. Jeff Sternberg, Sternberg Clinic, San Francisco, California. I want to talk to you about what makes a proper operation to cure you of your pilonidal disease. There are three principles. One is to make the deep cleft, which is the causative factor in pilonidal disease, more shallow. Being more shallow is important because it aerates the cleft and doesn't allow pits to form. Two, the operation needs to get rid of all of the empty, or what we call a surgeon's dead space under the surface. That is where a recurrent abscess can develop. And if you don't eliminate that, the body is very clever at filling it with fluid and redeveloping an abscess. And that also creates a flat bed of tissue for the thin flap of skin in the curative procedures to rest on. And three is to make the incision off the midline, off to the side, so it's in the open air and heals. Now, the caveat is it's impossible to completely eliminate the cleft because the anus always pulls it in, but as long as the lower part of the incision approaches the anus from the side, then it will heal, even if it opens up, because sometimes the skin is very irritated and thin there. So I just operated on a guy who had supposedly a cleft lift procedure by a surgeon elsewhere. The incision was down the middle, and there was a big hole at the bottom of that incision. Now, I don't know if that hole developed since the operation, which was 2 years ago, or it was left there because the surgeon told him that his case was extremely difficult because he had a very low opening close to the anus, and that if his cleft lift failed, that he might need a colostomy, which is absurd. No one needs a colostomy for their pilonidal disease, in my opinion. I reoperated on him, and I'm very satisfied with the way his operation went and what the incision looks like. So please do your research. If someone says something that doesn't make sense to you, kind of look it up on the internet and then get other opinions. Hope to see you in San Francisco.